Hello, everyone, and a warm welcome to the program. May I remind you that this is a revised version of the morning call as we observe and comply with all the necessary measures set in place to protect ourselves and save lives by halting the spread of the COVID-19. And now, more than 4 billion people in nearly 100 countries or territories are being forced or encouraged by their authorities to stay in their homes to fight the spread of COVID-19. According to a count carried out Tuesday from an AFP database, this represents more than half of the world's population. China's Hubei province and its capital, Wuhan, the cradle of the pandemic, were the first to be confined at the end of January. But it has now lifted its 11-week lockdown and has recorded no new deaths from the virus. According to a government count, nearly 4,000 people died in the country from over 80,000 infections. Now, these figures have come in doubt as Western countries get into their own battle. In the US, over 13,000 deaths. In Europe, over 50,000. And how about for the continent? The number of cases in Africa has risen above 10,000, and the death toll moved closer to 500 on Tuesday. So that was the grim factual picture there. But there are also good stories, the stories of thousands or tens of thousands, if not more, that have beaten the virus. With us now is one of them, Mamum Kato. Is a Ugandan based in London who recovered from the virus. And I'd like to appreciate you, Mamum, for taking the strong decision of sharing your recent ordeal with us. So, Mamum, it can take up to 14 days before symptoms of COVID-19 begin to appear. How exactly did you feel before your diagnosis?
So my initial symptoms were, I think initially I thought this was just going to be any other cold. I had the sore throat. I started sneezing. So the first week really was just normal cough kind of and flu kind of symptoms. So I thought that was it. However, in fact, I did recover. I felt pretty well after the first week. But then things started getting a bit worse after that, with the fevers really being the main problem, and then the coughing later on. So I would say timescale-wise, week 2 was the time when I realized that, hey, this is not any other flu, so I started getting worried.
And indeed, this correlates with what many have said regarding their first symptoms. Mamum, thousands of people are dying every day from this disease. Did this fact frighten you, and how did you deal with the difficulties, talking about isolation, quarantine, and treatment?
So, yeah, I was, as anyone else would be, I was a bit scared about it. And but I also knew that I had to be mentally strong and believe that I'll get better. I did a lot to manage it, manage my fevers, manage the coughing, and thankfully I had my doctor was quite available anytime I needed to talk to him. But I isolated myself just to make sure that I did not infect anyone else. And thankfully, that did help. I think the third week was the second and third week were the hardest. But I got through it, and I think it's important that people realize that mentally you really have to believe that you can beat it and prepare yourself and do what you can to manage the symptoms.
Amazing. And we're glad for you, very glad for you. Mamum, what would be your message in this fight against coronavirus?
I think the message really should be to the world is that we should take this seriously. this is not any other disease. I know the comparisons between different flus and malaria and all that stuff. Yes, the symptoms might be, for some, those symptoms might appear to be the same as a previous illness that you got. And as we know from what has been shared, 80% of people recover. However, that's not the point. Those that don't, those that are vulnerable, and those that have underlying problems will struggle, and it's not a good thing to go through. It's important that we listen to health professionals and governments and heed to the guidelines that it provided, because it's not only you that is going to be impacted, but a lot of people might get worse because of your actions. So I think we need to be considerate of what the implications could be for other people, and just adhere to the guidelines that have been provided, and hopefully we can all go through it and be safe without making anyone else sick. So that's the message for me, really.
Well said, and that message cannot be overemphasized. Thank you very much, Mamum, for sharing your story with us this morning. Thank you. Mamum Kato, a Ugandan recovered COVID-19 patient, speaking to us there from London, the United Kingdom. And now to some other stories making headlines across the continent.